Hi, my name is Jason Rutz with Freedom Healthworks. I'm the Partnerships and Outreach Director for Freedom Healthworks. And today we'll talk about, are you a good candidate for direct primary care? The concept is simple. It's a direct relationship between doctor and patient, and that's really it. So nothing that comes in between those two parties. So it's a very pure relationship, something that's not being done currently in healthcare. But I think it's all about freedom. They want to spend the time that they feel they need to spend with their patients. They basically want to do what they were trained to do. Unfortunately, current medicine really prohibits them from doing it because the amount of patients they need to see per day. Yeah, in our case with Freedom Healthworks, it really centers around the patient. So they're able to spend the time that they want to spend. They can talk to patients about things that they're not able to talk with their traditional hospital-owned system or network because there's not any way for them to bill it. And so this gives them the opportunity to say, if I wanted to have a conversation with you and talk about diet or exercise or things like that, they can. If I just want to spend time with my patient or you about a chronic condition that I feel like I need to spend more time than the traditional 15 minutes, I can do that as a physician in a direct primary care practice. You have to think about it with the analogy of building a house. So building a house is very complex. Building the frame is one thing. It's all the detail items that go into it. So it's very similar with us. There's a lot of things. You have the big ticket items. Finding the location, the space, planning out the space. But there's a lot of detail items. That can go with building a brand essentially. But what physicians should expect when going through the process with us is to be open-minded, is to be flexible, to really be involved in the process, because you have to think about when you start a practice with Freedom Healthworks, it's clean slate. So you don't have to think about the traditional practice anymore. It's really what do you want to get out of this practice? So I would say that's the most important thing as far as when you're launching this practice, is be involved and be open-minded, because now this practice can take on whatever you want it to take on. The doctor that this works for, essentially, you have to think about, even though this is a direct primary care practice, it's still physician-owned. So it takes a physician that's willing to go out there and talk to public, talk to people about what direct primary care is, talk about their practice, to talk about themselves. So those physicians that are willing to do that. Now, who it doesn't work for is those physicians that typically would like to basically punch in and punch out of their day. Maybe not go out and espouse and promote themselves and espouse the benefits of direct primary care. Because kind of where we're at with direct primary care is it's a relatively new concept, so it takes a lot of education, and the physician needs to be involved in that pretty deeply. I think the biggest barrier is just patient education, and those within healthcare that don't necessarily understand what direct primary care is. But I have to say, in our past instances where we helped do this for physicians, where they had no knowledge of direct primary care in the past, it does become relatively easy, because it's such an easy thing to believe in. And so our physicians believe very deeply in this. They believe that they should have the right to spend time with their patient without the next patient coming in the door and rushing them, or having to see 30 patients a day. When they experience what direct primary care is and the level of care that they're able to give to their patient, it makes it really easy to espouse the benefits of it. So it's not a scary thing, and it's not something that should be foreign to a physician. It should be relatively easy once they experience it. Physician thinking about, should I do this at the point where direct primary care is at this point, is to think about, well, am I willing to talk to people about how medicine should be? It kind of goes back to my point, are they willing to promote direct primary care? Are they willing to promote their own practice? Now, with our process of helping build a practice for physicians, a direct primary care practice, now we listen to that to an extent. We do a lot of the heavy lifting on behalf of that physician, but it all still comes down to, you have a patient walking in the door, and now it's your chance to sell that patient on your new practice, where that patient or that prospect may not understand what direct primary care is. So I think in that regard, it's really important to really understand the sales process, to think about those things that would resonate with that patient, make it very attractive to them to join one of these practices versus continue on with maybe a traditional practice that's more linked with their insurance. So I think that's something that I think physicians determining whether or not they should go into direct primary care, even with our help, still need to have that mindset. If you're interested in learning more about direct primary care, I'd love to talk to you. Even if it's a matter of learning what direct primary care is as a model, and if it could be a potential fit, I'd still love to talk.